Now, let's get some reactions from this is when they started talking, from our distinguished panel. Kim, why has the Benedum Foundation taken such a strong interest in children's oral health, and what do you see as the most important next steps for children's oral health in West Virginia?
Well, first, before I answer the question, I'd like to thank the Kids Count Fund and the Kids Count Board and the Advisory Council for producing this report. They took this on as a true labor of love, and on page 18, there's a list of people who served on the advisory. I'm coming in and out. Sorry about that. But I'm generally loud enough. Please let me know if you can't hear me or you hear too much of me. One of the guiding principles of the Benedum Foundation is that we encourage planning projects and programs that cross geographic and political boundaries so that people can access services and improve their economic standing. Over the past 7 years, the Foundation has been a very proud partner with many other wonderful organizations, institutions of higher learning, health and dental care providers, and government has played a tremendous role to help us to move the oral health agenda forward in West Virginia. During that time frame, the Foundation has made 34 unique individual grants that help to move the goals of the oral health plan forward. Those grants have totaled about $4.5 million. We want to improve the oral health status of all residents through public awareness, provider training, dental screenings, and access to dental care, and in particular, preventive care. Research has proven that having good oral health is a major indicator of having good overall general health. The Foundation knows that if we improve the health status of West Virginia, that it's going to require us to not compartmentalize a person or the parts of their body, but to look at the total health of an individual. For future next steps, there are very well laid out in the report, but some that are particularly important to me and from our point of view at the Foundation is that you always need to have a plan. West Virginia had an F, and we didn't have a plan, and we didn't have a state oral health director, and we didn't have this advisory council that met all the time, that worked on the advocacy issues, and we pulled that plan out, and I hold this group up with other groups that we work with as a shining example of not having a plan that sits on a shelf, but we look at it at every meeting, and what are we not meeting? That plan is current right now. It's 2010 to 2015, but it's mid-2012, so it's time to start work on the next plan because we didn't do that one overnight. So I think we need to always have a plan so that we not slip on anything that we've met as a benchmark and continue to improve on the indicators that we've barely met to get that A that we've given ourselves, right, Margie? Right. We also want to connect children and adults to a dental home. While the focus of today is on children, the oral health needs of the adults in West Virginia are just as grave, if not more so. So it is critically important that we focus on prevention and that we get people to understand that teeth are meant to last a lifetime. It is not something that we consider a luxury, but this is something that is the intended plan for our mouth. This will require cooperation between medical and dental providers in those communities to meet the total needs of a patient. The third is we need to continue to explore best practice models from other states because we have workforce issues. We need to think about what are the best ways to address the current shortages, where dentists are placed, access to care, scope of practice, other policy issues. We need to continue to strengthen our education system to prepare dental care providers, and we need to continually look at the payment structures in the state of West Virginia and if we are competitive in that. And the last one is that we need to continue to improve access to preventive care, particularly for the poorest of children, as Margie mentioned.
Thank you very much, Kim. Sister Harrington, how do the recommendations in our report align with the state's current oral health plan, and how might they be incorporated into the coalition's work going forward?
I think you must have taught school at some point. That sounds like one of those compare and contrast essay questions. Not to mention it means that you actually read the report. But actually, the oral health plan the intent is to provide a structured approach in order to improve the oral health of all West Virginians. It contains 7 objectives that encompasses 25 strategies. And I can pretty much assure you from recent work that virtually every recommendation in the Kids Count report is included in this plan. And some of those are related to direct services to children, such as expanding the number of high-risk children who receive sealants, and continuing to work with the medical community to promote oral health prevention, particularly with infants and small children. But as the essay notes, many child advocacy groups have been working collaboratively across the state, and the result has been the significant progress that we have noted. However, it is critical we look at how to sustain the progress we have made and also to continue beyond these minimal requirements. And that means working on policies, infrastructures, and finance, all those areas that are so critical to sustaining and improving oral health, and not only for children, but for all West Virginians. Both the report and the oral health plan include goals toward increasing Medicaid reimbursement for oral health, addressing the very challenging issue of the shortage or distribution of oral health professionals, particularly in rural areas, and helping people understand the critical importance of oral health to one's overall well-being. The oral health plan also includes the area of policy. A very recent achievement was the expansion of the role of the dental hygienist in regard to applying sealants to children's teeth. Now, personally, I believe there are other opportunities and that this is an area where we can and must learn from other states and even other countries. How can we increase the number of dental professionals in our state? How can our tax system perhaps better support or reward healthful choices and discourage the opposite, and on the side perhaps raise some money for prevention and treatment? I believe we need to look seriously at expanding the scope of practice for dental hygienists and at the concept of mid-level providers for oral health. And finally, for me, this issue is so critical that I believe we have a moral obligation to be open to serious and careful consideration of any option that has some credibility out there and that has the potential for improving the oral health of our citizens.
Now that is an advocate.
I've been called worse and probably still will be.
Thanks, Sister Harrington.
Thank you.
Next is Jason Rouse, our full-time dental director. And Jason, what is the state's Office of Oral Health doing to improve children's oral health, especially the oral health of children in poverty?
Well, Margie, certainly oral health has become a priority under Governor Tomlin and DHHR Secretary Dr. Lewis. Recently, there has been much focus on building the necessary infrastructure to implement change. This year, the oral health program has hired a full-time dental director and a full-time epidemiologist. Furthermore, the oral health program was influential in the development of the state oral health plan and the West Virginia Oral Health Coalition. The Children's Dentistry Project provides educational material, administers a school fluoride rinse program, and coordinates testing and reporting of private water systems. Upcoming plans include development, implementation, and evaluation of a statewide surveillance system and expansion of preventive dental services with the goal of children seeing their dental provider by age 1.
Thanks, Jason. We've got some questions sneaking up on us here. The next speaker is Richard Crespo. Richard is a new groom. I just learned. Did you guys know that? He just got married. Yay! Richard, Marshall University gathered the state's first oral health surveillance data. What do you see as the most important ways that that data can be used to make West Virginia a great place for kids' smiles?